Welcome to the office. Welcome.
Thank you.
Nice to see you. Nice to meet you. It's been a minute, and we need to talk about a few things. So, Jose, you've come from Puerto Rico with your wife,
Yes, sir.
and you've been here about 2 weeks.
Yes, about 2
And I
weeks.
know you were a little bit nervous maybe to share your story in the beginning. Then all of a sudden, you got so excited. You're like, let's share the story.
Yes.
And we're going to go through this visit where I want you to just kind of share. Why did you come here? Why did you have to come 9 hours on a plane from Puerto Rico and bring your wife with you?
Well, I was watching your video. We were suffering from a lot of discomfort on my back, digestion problem,
Okay.
lower back problems,
Okay.
and I was watching your video and see, what you do.
Okay.
And I thought, you were the right doctor to come and see, and also bring my wife. She
But
has
I
a lot
mean,
of issues.
it's a little trek. It's a little bit of a trek. Did you see anybody back home? Did you seek any help?
No.
No. So you just kind of have been dealing with back issues and digestion issues for a while.
Yes, for
Yeah?
many years. Yep.
Many years. Maria, would you agree? He's been dealing with this for a minute,
Yes,
right?
he has.
And how has it affected quality of life? Because again, to travel 9 hours by plane,
3,000 miles.
3,000 miles, and it's not a direct flight,
No.
it's obviously affected quality of life.
Yes.
Before.
Big time.
What was the biggest issue? Like, what was it affecting?
Well, it was affecting me sleeping at night.
Okay.
During the day, trying to do my daily routines.
Okay.
The pain on my back, it would not let me function normal.
The mid back you're
The
talking
mid-back.
about. Okay.
Yes.
Yep.
And it was very hard to go on with my day.
Okay.
It was impossible.
All right. Now you've been here. This is we're ending or winding down your trip here,
Yes.
and we have today Friday, and we're going to have our last visit on Monday.
Correct.
Right? How is the improvement? What's happened? Was it worth coming all the way out here? What changes have you gone through? And
Well,
what's different?
Well, 1,000%. What's different? Everything is different. The way that I sleep,
Okay.
to be able to go to sleep, I'm sleeping better.
Okay.
I have my digestion better every time I eat,
Less bloating.
less bloating,
Okay.
and way, normal. Before it was like always uncomfortable.
Okay.
And my back, middle of my back here is something that I cannot explain, back to normal from what it was before.
So from where you started 2 weeks ago to today, if we were 0 to 10 when you came, where were you when you came and where are you now? So you're saying there's no pain there now?
There's no pain there now. Before it was
Oh wow.
9,
Oh wow.
and now it's,
Yeah.
Wow.
you could say 0, between 0 and 1.
And do you remember what I explained on your x-rays? Because everything you were complaining was that mid-back, but we were showing that it actually is not the mid-back wasn't the cause. It was a result of what was happening where?
Correct.
In the foundation,
Correct.
right?
Yep.
And we focused a lot on the foundation. We did work a little bit on the mid-back. But if we look at all the visits we had, I would say maybe 25-30% we worked on the mid-back.
Correct.
Yeah, something like that. And so this is a good case, and this is good. I'm glad you want to share this. Can I go over a little bit on your x-ray?
For sure.
Yeah. Okay. So this is what happened. We did his full spine x-ray. We did his analysis. And we found a couple of things. We found some old tailbone injuries down low. And this is where we started. And we also know we have a leg length discrepancy, 10 millimeters. We do need to get that under 7. And we made some good changes with sacrum. We're probably going to put a little bit of a lift in today. And that lift you're going to walk with all weekend, and we're going to evaluate how it held. Okay? Because we need that under 7. Okay. Now, we're over here. So we stabilized here, the foundation. We're at L5. And we talked about L5 being a good 25-year-old injury. We've done a few adjustments on there, and I think that's been the game changer for you, is once we got the foundation, then we were able to work on L5. And the way I describe it is, look, this is the foundation. L5 is the first floor. We don't work on the first floor until the foundation is stable. And then we talked about these compensations, and the big compensation was happening from L3. L2 went off, and L2 takes the whole spine to the left, and the body compensates back at this mid back, T7. Next one to go off is T6, compensates back to T4, and then T2 goes off. And this is where the majority of his discomfort and pain was when you came in. Correct?
Yes.
But as we said, this wasn't the focus. We did a couple of adjustments, but it wasn't the focus there. And then we had some stuff going on in the upper cervical. You can see the digestion. Okay, you can see there's a lot of this permeated mouth appearance, small Blvd, a lot of gas, a lot of undigested food, and I'm pretty sure that's also changed while you've been here, meaning you're going to the bathroom is different now.
Yes.
Yep. Now, when we're looking at the posture, what did we see? We see a slight reversal of the neck, and that reversal, we can see a disconnect in George's line from the back of C4 and C5. It's a disruption of the vertebral bodies. That's more of a ligamentous issue. Again, that's compensation to things happening down low. This neck curve is going to take you some time to get back. You're going to be doing some basic exercises at home. And it may take up to a year to get that back, maybe more. But it's going in the right direction now. Okay? And what do I mean by basic? Is bouncing on a gym ball and doing flossing for your spine. Okay? And we're going to go over all that on your last visit. Okay? And so this, again, the neck curve, if this isn't stable, neck's not stable. If this isn't stable, this isn't stable. All right? Questions on that?
No, good.
Okay, have a seat. Let's see where we're at today, Jose. Starting at the base of the neck. All right. A little bit of a chatter, but no real break up top. Neck is good up top. And that's around T3. Upper back. You guys got some good walking in yesterday?
We did.
Or just sleep?
No, we won't.
Oh, who's that in the corner over there? That's Maria. She's going to be next. And Maria and Jose, as I said, they came down from Puerto Rico. And I appreciate the traveling down and taking all your necessary precautions to make sure you guys were safe and that everyone here was safe too. Good. Now, of course, all these things are going to show up today, right? But now what happens? This is compensating that cleared out. All right. Tiny bit at L5 today. L5 around T3. And let's check up top. Fantastic. So, Jose, today we have T3, we have L5. Okay, head down, round your back, please. Static palpation, running our fingers down the spine. And it's interesting, people ask me about this filming, so I do want to mention it for just a quick second. We just asked if people want to share their story, okay? And the first visit is where we get all that good information, okay? We get all that good stuff, and we spend a lot of time hunting, and investigating what the issues are. And I know it's a little bit nerve-wracking for people, and I mean, it's interesting how now the shift happened, because first day you guys didn't want to, then all of a sudden, hey, Rahim, can we share the story? And I try to encourage people, if they want to share their story, it's great. And even if they don't, it's still a good idea to film that first visit for the archives. Again, I don't force anybody to film. I don't give discounts. I don't give kickbacks for it. It's just you want to share your story, share your story. And as I think with you, Jose and Maria, you clicked with somebody's story, whoever that may be. One of those stories got you.
Sure.
7. 1, 2, 3,
Yep.
2, no, 3. 3. T3. And let's check the low back. Sacrum. Now, this is S1. S2. This is where we started, sir. Bueno?
Bueno.
Bueno. Número 5. Still good.
Bueno.
Tiny bit. Not bad. Bueno. Número 5, número 3. Para. Shh. Listo?
Yes, sir.
You ready, sir?
Yep.
Let's do this. Now, let's do T3. Let's do T3 over here, please. T3 as a PLS, posterior left superior. I think it's going to be a good idea for me to do a listings class to explain when I say these different numbers and listings. T3 PLS. Good. Now, let's bring the hands here, sir, up to receive. Good. He's tight. T3. Gotcha. Nice. Let's get that L5. Now, I'm lifting the vertebrae. I'm going to hold you right here on the side, okay?
Okay.
Now, let your tummy go down. There you go. Nice and easy there. Shh, come here. Come here. L5. Tummy all the way down. Good. And that's the home run. Nice. Come up slowly. Fantastic. Let's
Good.
walk. Yep, let's walk. Pretty good, sir.
Yep. Very good.
L5 and T3. All right, come over here and have a seat. Let's recheck everything. Maria, his sitting is different, very different. How has his energy and attitude been the last couple of weeks?
Better.
Calm, more calm. T3 is clear. Bueno. 5 is clear. Back slowly towards me, sir.
Yep.
Nice. Número 5. Número 4.
Nice.
Número 5. Ah. Bueno?
Bueno.
Bueno. Good. Okay, sir. Next, let's continue. Let's do the shoulders. Over, around. Nice. Over. Nice. Let's go on your back, please. Over here. Raise your right leg. Good. We're doing an AS talus medial tilt. That's the ankle bone tilting on the inside. I'm going to use the speeder board for it. There you go. AS talus, medial duele.
Yep.
Poquito. Medial tilt. Nice. Awesome. Sit up and turn, please. Now you're going to get the buff and the polish.
Nice.
All right, senor. Let's check your hands. Stand up, please. Squeeze. Squeeze. Very nice. Squeeze. Poquito. Anterior lunate. Nice. Squeeze. Posterior radial head. and posterior lunate. That was actually a posterior lunate. I said anterior, sorry. Squeeze, squeeze. Good. Turn, please. Dun-dun, dun-dun, dun-dun. There you go, boss. Anything else you want to share?
Anything else? Well, I guess in the last visit we'll share the final result. but
Sounds good.
Sounds good.
Sounds good. So Monday it's Friday. We have the weekend off with me.
Correct.
And Monday will be our last visit, and we'll wrap everything up.
Sounds good, sir.
Sounds good?
Yes, sir.
All right, so Jose is done. Maria!
Maria.
Oh, Maria! Come on down. What's up, Maria?
Everything's good.
Hi!
Hi.
How's it going?
Good.
All right, so you came with your husband. He dragged you out here from home.
He did.
He literally dragged you here.
He did.
You were fighting, kicking, and screaming to come
I was.
or to not come here. Correct?
Correct.
Tell, tell us what happened.
I came in with lots of discomfort.
Okay.
Like I said, my neck, headaches, lower back, and my knees.
Okay.
And now I feel big relief
Where?
from even my knees. I have to say, I thought, well, maybe he can help me with my back, but my knees, no.
Oh.
And I feel so much better.
Did I work on your knees?
I believe you did.
A little bit, not
Just
really.
a little bit. Yeah. I think the right one.
Yeah.
You did a little something, I don't know.
A little something.
But I feel relief on my knees.
But we didn't really do a lot on the knees
No.
itself. Where was our focus?
The back, the lower back, and the neck and the shoulders.
Cabeza.
Mm-hmm.
Cabeza.
Yeah.
Okay. So from where you started 2 weeks ago to today, how would you evaluate your improvement?
From, let's say that I had the pain in 10.
8 out of 10?
8 out of 10.
And now?
Now I would say like a 2
Okay.
or 3, but it's crazy because it's not a pain. It's like pressure.
Sore.
Yes.
Like, is it kind of like a workout? Like after you worked out really
Yes.
intense?
Yes.
And the next day what happens? Everything is sore?
Yes.
You're
And then
moving.
yesterday was when I mentioned that I felt uncomfortable.
Yeah.
I was bloated. My head was hurting like a lot.
Okay.
And I had a lot of pressure on my lower back and my shoulders. But then today I woke up feeling better.
But you also said yesterday was a little different.
It was.
It's okay you said
Yes.
it was cycle
Because
time.
before it was
But
pain.
you're
Exactly.
talking, this is related to the cycles.
Exactly.
Now, I'm not treating anything for cycles.
No.
I'm just doing whatever I'm doing.
Exactly.
And tell me what was
But
different
before,
in this cycle.
when I used to get my cycles, it was pain.
Okay.
Now, last night when it started, it's pressure. I don't know if I'm explaining it right, but that's how I feel. It's not a pain.
Okay.
It's pressure.
Was
like
she a little
pressure.
less moody, Jose?
Yes, she is.
A little less PMS?
Yeah.
Yeah?
Yep.
Okay.
Yeah.
This is
And
good.
it was weird to explain it. He's like, is it pain? Are you in pain? No. I just feel pressure. So very different from when I used to get my cycles before.
Okay. And the headaches?
The headaches are different. It's not pain. Like if someone is grabbing me, it's more pressure too when I get them.
Okay. And since you've been here 2 weeks, less headaches?
Less, and I haven't been drinking the Advil. I just wait
Okay.
and come and get adjusted, and I feel great.
Okay. So you haven't had any of that since you've been here?
No, not well. Last night I drank the 2 Advils, but before that, no. It goes away on its own.
Okay. All right. You ready?
Yeah.
Anything else you want to share?
No.
Let's get started. So, Maria, on you, we did the right pelvis, the EX pelvis, and we did the atlas, yeah? Now, let's see what we find today. And if we want to go over actually to her x-ray, we can talk about her low back. And when we're looking at the low back, there's a couple of things I just want to mention. And same thing with hers. A lot of it was in her foundation. We found something down low at S4, a rotated sacrum with an EX pelvis. We've cleared this up and we got to this component here. L4 is also an issue, and as you can see with the line drawings, L4 starts to change all of this, the lumbar spine, to T11. The next one to go out is T10. You can see some old arthritic changes here. T10 takes the spine all the way up to T6, and then the next is T5 that goes off. And a lot of this is, again, compensation, old injuries, and this is all starting from the foundation. Okay. I adjusted your pelvis. How did you do with that pelvic adjustment?
On my right side?
Yes, ma'am. No, on your right side. Remember when I pulled that pelvis?
Yeah.
You did okay with that?
Yes.
There was not any extra soreness from
No.
that? Okay. All right. Let's take a look and see what we got today. Let's see. Poquito más. Tiny bit up top. So that one shifted. It looked like there was something there in the upper. I want to show this. So it looks like it's going to break in the middle back. It's shifting around. It goes to the right, all the way to dos o tres. Sacrum is clear. L5 is clear. Little heat there, but the big one I'm getting is L3. Let's do that. Now it's switched again. Let's try that again. Nope. Now it's back down here. Let's do that one more time. Body's playing tricks on me. Yep. Right SI joint. Right SI joint. Right atlas. Scoot forward, please. Feet together. Open and close the knees. Open and close. Good. Right side only. Good. When she does the right, left is good. Do the left side. There's a tiny bit there, but not too bad. Scoot back for me, please. Número 5. Bueno. 5. 4.
Bueno.
3.
A
Little tender.
Little.
Okay. That's what was throwing me off. It looked like there was a break there, but I think it's compensating from aquí.
Okay.
Sí.
Yes.
Número 1.
Okay.
Número 2. Número 1 on the right.
Uno.
Derecho.
Yeah.
Left side. 1.
Yes.
Right side more. Left side more.
Right.
Yes. Right side. So we have the right rotated sacrum with the pelvis. We will do the quick Gonstead leg check before we adjust it, just to confirm. Sit back for me, please. Now, let's check the neck. 6, 5, 4, 3, 2. 1. Right side down. Left side down. Aquí. See?
Yeah.
Right side.
Mm-hmm.
Okay. Right atlas. Now, let's have you go face down. Let's do the leg check. Now, let's watch your ankles. And we said it's the right side. Okay. And let's see. Slide down a tiny bit more, please. There you go. So what we can see here is the right is a tiny bit shorter than the left. Just a tiny bit. Okay? Mira. The right heel is a little bit shorter than the left. Just a tiny bit. We're going to then flex the knees. Let me do the work, please. Maria, let me do the work. If it stays short, sacrum. If it goes long, pelvis. Let's try that again. It's darn close, huh? But from short, it went a tiny bit longer, didn't it?
Yep.
Tiny bit longer. So we're going to do the pelvis. Okay? Awesome. Stand up, please, Maria. Okay, we're going to be down on the EX pelvis. Lift up. Lift your bottom butt up. And I got to be right there, ma'am. Okay? I'm on the EX pelvis. Pisiform is right on the lateral aspect of the PSIS. We're going to pull in like that. That's a tiny bit. Let's go face down over here. Okay, right pelvis, right EX. Bueno? Respire. Sáquelo. Stabilizing the left, pushing the right. Gotcha. A little more. That's the one. Gotcha. Thank you. Now, turn your head to the right. Right hand here. You can let go. Slide up a little more. Un poquito más. Yeah. And ASR Atlas. Good. Gotcha. Slide up. Left hand here, please. Coming down just a little bit on the arch. There it is. Good. Gotcha. Oh, Maria. You're making me work. That one I gotcha. Okay, let's walk that off a couple of times, please. That was a lot deeper than previous.
Yeah,
That was good.
feels good.
Settle. Things are going to shift around. I need you doing lots of walking today, okay?
Okay.
All clear. Scoot forward, please. Forward, forward.
Oh,
Now, remember what that third lumbar felt like?
yes.
5, 5, 4. See?
Yes. Bueno.
Bueno. Feet together. Open and close the knees. Open and close. Right side only. Oh, what do you know? Left side only. Yeah, what do you know?
No more pressure.
Yeah. Fantastic. Let's take a look at the jaw. Slowly open. Slowly close. Slow. So the left actually goes out first, the right compensates. Open. Better than day one though, for sure. Open up. So the EX is on the right, the AI is on the left. We're going to do the EX first. Open all the way, close halfway and hold. We're at lateral to medial pressure on the right side. There it is. Got it. Now, let's use the condyle block. This is to stabilize the cervical spine. And we're going to do the left TMJ. Left TMJ, open all the way. We're going to bring it out more. Open all the way. There. And right back in. There you go. 1, 4, 3, 2, 1. Okay. Now we'll use the machine. Awesome. Elbow, let me do the work. Let me do the work. And let's check the hands. Oh, wait a second. You came for your knees. I think I should check them. Oh, go on your back, please. Right knee?
Both.
But right was a little more? Or
yeah.
left?
She
don't even remember.
Yeah, I know.
Okay, so let's do this. Tell me what I'm checking for is patellar tracking. I'm checking for any clicks or pops. No, nada.
Nada.
Ah, poquito.
Poquito.
Nah.
Nice.
You get to act a little weird today or this weekend. I want you to do some backwards walking.
Really?
10 minutes a day this weekend.
Okay.
Yeah. Well, it's good, lady. You don't need to mess with the knees. Stand up. Squeeze. 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 Not shake. Squeeze.
Oh.
Squeeze. Good. A little bit on the elbow. Thumb. And lunate. There. Squeeze. Radial head. Posterior distal radius. Posterior lunate. Nice. Squeeze. Squeeze. We're all set for today, guys.
Thank
Questions?
You. Oh, we're good.
No questions. We're good.
Enjoy your weekend.
Thank you.
See you guys on Monday.
Work
Yes, sir.
every mile.